Back to our top story now, and Boris Johnson's press conference attempting to get his COVID response back on track. Well, I'm now joined by an expert in communicable disease control, Dr. Bharat Pankhania. Thank you very much indeed for joining us here in the studio. So 7,000 cases reported today, and indeed over 7,000 yesterday. Boris Johnson, he's had to do something, hasn't he? And obviously he's addressed the nation this afternoon.
Whilst he has, I tell you where I feel a little tinge of disappointment is that notion that people disobeying are to blame. I don't think people are to blame. What is required is sincere, consistent, succinct messages and not blame people.
Doesn't help when the Prime Minister himself is confused over the messaging. What impact has that had?
Well, I think if we go back to not only the messaging, but if we go back, I feel the tipping point happened when one of his advisors was found to have broken the regulations that they made. So my intelligence picks up that people started to give up at that stage and say, if they can do it, we will do it.
What should the messaging be, though, to prevent the spread of the virus?
The important message is this. This is a human-to-human infection, and therefore you must restrict your movements with fellow human beings. It's as simple as that. The second bit to the message would be, please don't get infected and please don't infect other people.
Local lockdowns, then, do they work? Obviously, Scotland has done this lockdown concerning households mixing. Should we be having a blanket measure across the whole of England, and indeed across the whole of the United Kingdom?
That is a stop-start elastoplast measure. What we need is the better measure, which is this is a human-to-human spread of infection, and you will restrict your movements with fellow human beings for a very long time. Because what is happening with lockdowns is we restrict our movements, and then as soon as you say lift the lockdown, we start mingling again. The chain that has to be broken is you do not mix with other people. People outside your groups will give you an infection. Don't mix with them.
But we can't close down schools, we can't close down businesses. The country economically has suffered because of that pretty severe lockdown we had earlier this year. So is it really sustainable, what you're suggesting?
Where we have got our things wrong is we need to get the public health measures right, and when you get your public health measures right, your economy will go right too. At the moment, what we're having is the stop, the start, the stop, the start, and that is harming both communities and economy, and we can't sustain it. What we have to do is get those messages right, and that simple message of don't get infected, don't infect others is important.
That's what you mean by public health measures?
Absolutely.
So it's individual responsibility?
It is our individual responsibility, it is our mutual responsibility. We do it together, we don't blame any one group, and we get our messages right. So for example, we've got the universities all opened up, we've got schools all opened up. Where it is feasible, I have now changed my mind. I feel if you can teach remotely, please do so, because it is not sustainable the way the schools are running at the moment to carry on and then shut and close a group, open a group. It's not going to work.
What about the fact that maybe many of us seem to be panicking because it's young people who seem to be responsible for the huge rising infections, many asymptomatic, and also the fact that we're facing the winter, we're getting a huge rise in cases, but we're not getting a rise in hospitalisations or indeed deaths at the moment. And some commenters are saying this is not nearly as bad as what we had at the beginning. What do you say to that?
Well, what happens now with the younger age group will transgress, which will transfer to the older age groups, and it will transfer to the more vulnerable groups as well. So we just cannot let go and say, it is a problem of the young, don't worry about it. What happens in this age group will move on to the more vulnerable groups.
Are we going to see as bad a situation as we saw earlier this year?
I hope not. And my reasons are, I think we've learnt the lessons of care homes, nursing homes, and we'll take precautions over there. I hope so. And the people who are vulnerable know who they are, and they're taking extra precautions too.
Dr. Bharat Pankhania, thank you very much indeed for joining us in the studio.